Our second speaker is Dr. Alyssa Olivas Vanderlinden, who is an assistant professor in kinesiology. She earned her bachelor's degree in biology and her PhD in biomedical engineering from UTEP. She's been at NMSU since the fall of 2023, and her research focuses on clinical gait analysis, biomechanics of the lower extremities and trunk, and the relationship between cognition and mobility in children with autism spectrum disorder. Her emerging scholars project specifically focuses on various dual tasks performed while walking in children with autism and how that may impact their walking patterns. Please welcome Dr. Vanderlinden.
Thank you all so much for the introduction and for being here. I'm excited to share the progress that I've made so far on the project. Again, we're also somewhat in the early stages. We're in the data collection phase, but excited to show you what we've been doing so far. Okay, so as far as some background information, each year in the United States, 1 in 36 children are diagnosed with autism spectrum disorder. And typically this is regarded as a behavioral disorder with behavioral symptoms. So things like deficits in communication, in social interaction, a lot of repetitive behaviors, and it's primarily diagnosed using behavioral assessments. But there's recent research that suggests that actually motor skills are a prominent area with which autism impacts children. Over 80% of children tend to have deficits in motor skills, and that's where my research is focused on. Particularly, I'm interested in their walking patterns. And so this can manifest in several different ways, but typically it presents as a less coordinated walking pattern compared to neurotypical children. So there has been some research done so far on their gait patterns and some of those key differences that can be highlighted. So this includes things like, again, the atypical gait patterns, postural instability, differences in spatial temporal variables, which have to do a lot with timing and placement of the feet as they're walking. So things like wider step width, decreased step length, slower walking speed have been identified in this population, as well as reduced range of motion of the lower extremity joints while walking, as well as increased asymmetry during walking as well. In addition to these motor skill deficits, another area that is impacted is cognition in children with autism. And so some of the commonly impacted domains are executive function and attention. And over 1/3 of children with autism tend to have impairments across multiple domains. And in other populations, such as elderly adults and those that have neurological disorders, it's been shown that there's a higher level of cognitive impairment that's associated with poor motor and overall walking performance. And so this may highlight the need for there to be some research in this area, specifically with children with autism, to see if the identified cognitive impairments that they may face also have some relationship with the motor skills as well, and seeing if it affects things like their adaptability during walking and overall daily functioning that they may be required to do. And so one way that we're able to nicely look at the relationship between cognition and someone's motor skills is by introducing this dual task paradigm. And this is basically trying to do two tasks at once. And we're trying to use this paradigm in order to understand what are the attentional demands of a certain task, what is required from the higher levels of cognitive processing in order to perform the task, as well as how those task performance may be altered by the presence of that secondary task. And so I'm mostly interested in walking while performing another task. There's several different ways that you can do this. There's cognitive dual task, which involves a secondary task that draws a lot of attentional resources. And there has been research that has shown that there are several impacts on walking patterns in able-bodied individuals. And then there's also motor tasks, which is another motor or physical task that someone would be expected to do while walking. And so this has also been shown to have some impact. It's a little bit more of a subtle impact in walking patterns, but it's starting to compete with the motor resources that are required for walking to occur. And so there's been some research in this area on neurotypical children, and it's been shown that both types of these dual task, cognitive and motor, do have some impact on their walking abilities. And beyond neurotypical and able-bodied individuals, this type of research is also used in a therapeutic setting. Clinicians are interested to see, as far as different tasks go, what kind of attentional demands do they require, right? So what exactly is required of a certain task? Is it an automatic task? Is it something that we can do without thinking about it and nothing really changes in our walking pattern? Or is it something that we do see the impacts? There is a level of a higher level of cognitive processing that needs to take place, and this can help with diagnoses, with intervention methods. And so we're just trying to understand a little bit more what these type of scenarios do to walking patterns, and just be more informed overall for certain populations. Now, for children with autism, there has not been a lot of research in this area. And so this may be of particular interest because we've kind of talked about there's the deficits in their motor skills, as well as the cognitive impairments that they may face. They also are 50 to 70% of them that are affected with other comorbid conditions that affect their attentional resources. And so this is definitely something to look into, to understand how they may respond to these types of scenarios. So that leads to my research question that I'm investigating with this project, which is to examine the impact of motor dual task and cognitive dual task on gait in children with autism spectrum disorder, also looking at their cognitive performance, how that may change, and comparing it to neurotypical children. I'm anticipating that the children with autism are going to show some differences in their gait patterns during both types of dual task scenarios compared to their neurotypical peers, and that the cognitive dual task is going to showcase the most pronounced impact on their gait. And so for this study, I'm recruiting 20 children with autism spectrum disorder and 20 age and sex matched neurotypical children. They're going to be between the ages of 8 and 17. I've been really lucky to have partnered with the NMSU Autism Diagnostic Center. And so a lot of our participants have been recruited from them. But they have to have their clinical diagnosis of autism verified by a medical professional. All neurotypical participants have to be free of any other neurological condition, and all participants have to be free of any orthopedic condition that may impact their ability to walk. And so once they come to our biomechanics lab, they're instrumented with 46 retroreflective markers. So all these little things that you can see kind of lighting up here on our participant, and it's mostly focused on the lower extremities and trunk. And by putting these markers on our participants, we're able to track their movement while they perform various tasks in the lab. And so we're able to collect that movement using motion capture cameras that we have, as well as force data, and we use some force platforms or force plates in order to collect that data. And so as far as the dual tasks that they're expected to do, for the motor task, they're expected to balance 3 tennis balls on a tray. And while this may seem a little simple and easy to do, it's actually quite challenging unless maybe you've had some training as a waiter or waitress. But it's definitely a complex motor task that has a lot of cognitive and physical demands that need to all really come together in order to successfully complete it. It takes a lot to manage balance, coordination, attention in order to achieve this. And it also involves a lot of fine motor control. And so that is what they're doing for their motor task. And then for the cognitive task, they're doing the Stroop color word test. And this is a commonly used cognitive assessment. Maybe some of you all are familiar with it. It measures different things as far as cognition, executive function, processing speed, cognitive flexibility. And so they're given various color words in different colored ink, and they have to say the color of the ink rather than read the word. So the first example that I have here, it's the word red and the color red. Our answer is red. Over here, it's the word blue, but in the color green. So our answer is green. And so these are the tasks that our participants are expected to do. And so these are our conditions. First, they just do some normal walking in the lab, and this is at a self-selected speed. They're just kind of told to walk as they normally would at school, their normal walking speed, pace, however they would like to move their body. We want to just understand what their baseline looks like for walking. And then we introduce the different dual task conditions that we just spoke about. And then they're also doing some static conditions of these secondary tasks in order to determine what their baseline is for that dual task, whether it's the motor or the cognitive task. And after we finish collecting all the data, what we're going to really be interested in is their kinematic and kinetic data. So we want to know their range of motion as well as their maximum flexion and extension angles for their lower extremity joints as well as their trunk, which are going to be very impactful in their walking, as well as the forces and the torques that are generated about each of the joints. We're also going to be interested in the dual task performance. So we're going to look at, as far as the motor task, how many balls fall from the tray as they're completing it. And then for the cognitive task, how many answers they get correct out of the total answers that they give, and the error rate. And so basically we take all of the data that's collected on so it's a lot of computer processing that has to be done. We get basically a bunch of gray dots, and then we have to go through and label everything anatomically. So this is kind of what it would look like. We get this almost stick figure-like model that's generated, and that's how we're able to calculate all of these variables. So this is kind of what it looks like and a lot of the data that we're going to be working with. As far as progress, we've had 13 children with autism participate so far and 6 neurotypical children. We're in the process of analyzing the data. We hope to continue collecting over the summer and start analyzing late summer and early fall. And so here is one of our participants doing walking while doing the Stroop test, and then walking while carrying the tray of tennis balls. I've also been really lucky to have a lot of undergraduate student involvement in this. And so some of my undergrads that work with me came with me to the Celebrate the Spectrum event, which is hosted by the NMSU Autism Diagnostic Center. We just showed our support for the community as well as let them know about the cool research that we have going on at NMSU. I also had 4 students present at IRCA's last Friday, and these are some pictures of them. And one of the groups actually won the outstanding poster presentation in STEM, so very proud of them. Very lucky to have them a part of the team. And as far as the significance of this project, it's really just to improve current movement therapies that are existing for this population. This can include occupational and physical therapy. We just want to provide more normative data for this population to see what the key differences may actually be. How do we address them? Are there certain motor or certain cognitive areas that we need to keep in mind when working with this population? There is an unmet need for motor services in this population. Kind of in the beginning, I mentioned that 80% of children with autism tend to have deficits in motor skills, but there's a large disparity in how many of those individuals actually seek out physical therapy and movement services. So we want to make sure that we have the appropriate services for them, and just overall enhancing their quality of life, their independence, their physical activity levels. And so that is what our goal is with this project. I'd like to thank all of my undergraduates that have helped me so far with the study, as well as the Emerging Scholars Grant from the College of HEST. And I'd also like to thank the participants and their families for taking part in this research. They've been amazing and they have been really great. We're still actively recruiting. So if you happen to know anyone that may qualify for the study, I have my email listed there. Feel free to shoot me an email and we can discuss the details of the study. But it's ongoing, it's active, and we hope to finish up soon. But thank you so much for your attention today.
For questions?
So for the baseline gait walking, is the 12 trials enough to maybe like get over any shyness they might have? Because when you like start having to think about how you walk, it can change it. Is 12 enough trials to even that out?
It is actually. So they do walk across a pretty long runway, and there's several gait cycles within that. And then we also give them kind of a familiarization period at the beginning to make sure that they feel comfortable walking. But it is kind of tough, right? All people looking at you, you have all this stuff on you, trying to walk as normal as possible. So we just try to encourage it as much as possible. And a lot of them seem to be doing great. Yeah.
Have you thought about or explored doing this with younger children, and how would that look?
It could definitely be done. We choose 8 as the minimum age because that's typically when their walking patterns have matured a little bit more. But there isn't as much research in children younger than 8. So it would definitely be something interesting and definitely something to look into. There may not be as much supporting evidence for it or what we may see, but it's definitely something that we could look into for sure. Yeah. Yes.
What control factors are you including in your study? So you have the primary outcomes, but these children might vary, right, in the extent to where their parents expose them to different things and activities and.
Yeah, so a lot of the current research that is out there is kind of just more convenience sample of people that are willing to participate. So we are not necessarily controlling for it. We're going to kind of take the information that we're given from their diagnosis report and run that and see if there are some external factors that may play a role, but it's not something that we will control from the beginning.
So not necessarily controlling, but like measuring, right? Just like.
Right. Yes, not necessarily anything at this point.
Oh,
Sure.
but yeah, I'm wondering if you do, are all the children diagnosed with autism, speaking, like, were there any of them using devices, or was that something that you had to exclude?
Yes, so all of them do have to be verbal in order to do the color word test and be able to say those words and what their answers are. So yes, all of them do have to be verbal. And that is a potential limitation that we are focusing on more of the high functioning side of the spectrum, but there are definitely other types of dual tasks that may meet. The cognitive ones may be a little difficult with the nonverbal, but the motor could definitely explore the nonverbal side. Yeah.
Great, thank you very much.